As provincial officials urge everyone to stay home, that message lands in a very different way if home is a correctional facility. That's particularly true as reports surface of COVID-19 cropping up in prison populations. With us for more, in the nation's capital, Kim Pate. She is a member of the Independent Senators Group representing Ontario in the Senate of Canada. In Midland, Ontario, Chris Jackel, Correctional Officer and Chair of Ontario Corrections Division for OPSEU, the Ontario Public Service Employees Union. And in Toronto, Lee Chapelle, President of Canadian Prison Consulting, Inc. That's an advocacy and reform-based firm. And we are happy to welcome you all to TVO tonight with our new kind of makeshift broadcast out of the attic of my home. I hope everybody's doing well. And Senator Pate, why don't you get us started? How well do you think our prisons in this country are equipped to handle the pandemic we're currently experiencing?
Well, I'd say most are not. Certainly at the federal level, we've seen some incredible foot dragging by the Correctional Service of Canada. Some provinces and territories have worked hard to try and reduce the numbers by using temporary absence measures, by encouraging police, prosecutors, and judges to utilize their discretion to not front load the system in the provincial jails. But in the federal system, we already know in Grand Valley and Kitchener-Waterloo, there are 6 cases that we know of prisoners, 1 of staff. And we're talking about a population that it's very difficult, one, for them to practice the physical distancing. 1 in 4 of them are considered in the elderly category. Many have compromised immune systems and cardiopulmonary conditions, chronic health conditions. In addition, we know that the prisons are often in smaller communities. And so the fear is that if we don't actually reduce the numbers so we can engage in the physical distancing that we're doing in the community, if that can't be done in the prisons, then we'll likely see the kinds of outbreaks we are starting to see. And that could overload the health care systems in the communities where those prisons are located. So it's in everybody's interest for us to actually start to reduce the numbers, ensure that people, particularly in units where they have shared toileting and food eating facilities and shared recreation, that in fact that is minimized. Instead, what some institutions are doing is engaging in massive lockdowns, which is, because staff still have to come and go and may be asymptomatic, we're seeing is actually not stemming the tide or the growth of this.
Okay, Lee, as I invite you to participate here, I think everybody knows what a senator does. I think they know what a union leader does, but they may not know what you do for a living. So just start by giving us the brief 411 on what you're up to.
Right. So inevitably, every time I say I'm a prison consultant, yes, it triggers questions. We work with people typically on bail, first-time offenders. We prepare them for incarceration. So etiquette, certainly dynamic. But we cover a lot of paperwork. We build release plans. We proactively address mitigating factors that brought people to the point in their life where they're facing incarceration. Work with defense lawyers, trained defense lawyers on the Corrections Conditional Release Act, the legislation that governs corrections, parole boards, process, setting up manageable risk releases, structured releases.
Gotcha.
So this is what we do.
Sounds like a full service operation there. To the best of your knowledge, do any of your clients have COVID-19?
No, they do not.
They do not. Okay. Now, based on your knowledge of the prison system, which for those who haven't seen you on this program before, you know about from the inside, you've done time in the past.
Correct.
How well do you think this system is able to handle the current COVID-19 crisis?
Well, I think it's tough. I think what it does is it illustrates that it's an antiquated system. It's a little overcrowded for the most part, clearly. Prisons and jails stand to be like stationary cruise ships or old age homes. They're a breeding ground for the virus. I think there's real concerns related to cases that do surface within, and there's an interconnectedness within the community. So there's a real concern there. Something I'd like to see is PPE for correctional officers, those that come and go, so they can protect themselves, their families, and inmate populations.
Chris, do you have any idea what percentage, if any, of the people you represent would have that personal protective gear?
The numbers are very, very small. That's one of our struggles, actually, is to get confirmed and repeated access to PPE. Now, we do have some PPE in our facilities, but it's been limited. And in some instances, it's actually been quite frustrating. We've had a number of situations just recently, Monteith, Sarnia, for instance, Southwest Detention Center, where we have had inmates on presumptive testing or on droplet precautions, and the staff working in that area were literally denied access to don PPE. So that's been very, very frustrating. Now, in some of those situations, the corners turned a little bit, but again, there is no real clear direction. Lee says it very accurately. An institution is very, very similar to a cruise ship. Everyone is really in a congregated setting, and there is no opportunity to move about or create that distance.
Even hand
Especially
sanitizer, would you have that?
We do have enhanced cleaning products, yes,
Okay.
for staff and for inmates, yes.
Senator Pate, let me go to you. How in heaven's name is a penal institution supposed to practice physical distancing when, as Lee has suggested, things are pretty packed in there as is?
Well, it's very difficult when you have people with shared toileting facilities, sometimes shared eating areas, and certainly shared recreation areas. And so the only way really is to use lockdowns or to release the numbers. And we know that the United Nations Human Rights Chair has called for releasing prisoners right throughout the globe. And in this country, we've been slow to see it done in the federal level. Some provinces, Ontario and others, have been ahead of the game in trying to institute temporary absence programs, use intermittent sentences from coming in. But what we really need to see is a robust system to get out those who are low security, who may be days, weeks, or months from being released anyway, who would not cause an increased risk to safety, as well as those who have compromised immune systems. And that would make up space so that we could do more of the physical distancing and ensure some of the hygiene practices that we're practicing in the community, the healthier measures, could be utilized within the prisons as well.
Now, you are the one politician on the program today, so I guess it's part of your job to have some understanding of what public opinion would think if we allowed prisoners to get out of jail early. Do you think that idea would find favor in the Canadian population?
Well, I think it depends on who you ask. Many people know that the majority of us have done something for which we could be criminalized, but often aren't, largely dependent on who we are, what opportunities we have. And so many people are being in touch saying they strongly support this. Family members are calling saying, what can we do to try and ensure that our loved ones are home? Some communities are saying, could people come and help build some of the infrastructure we need? And then there are some absolutely are saying, we don't want people released in the community if that will increase risk to public safety. Well, I live in the community as well. You live in the community. I would not be advocating something that would increase risk to public safety. Quite the opposite. What prompted me to take action were medical professionals getting in touch with me and saying, if we don't stop this, we're going to see what's happening, as Lee has mentioned and Chris has mentioned, on cruise ships and homes for aged care, where individuals not knowing they have COVID, may be asymptomatic, carrying it in. Once it gets into an institution, it can spread. And then the threat and the strain on the healthcare system in the communities where these prisons is a big part of the problem, and that will increase the risk to health and public safety in the broader context, because if we have overloaded systems, obviously we're not able to flatten the curve, the demand on the healthcare system that's being expected as well. So I think it's in all of our interests, and I'm very happy that you're doing this piece to help educate the public in case people are thinking we're talking about throwing open the doors and increasing risk to public safety. That's the last thing we're talking about.
Chris, I should get your view on this. Given the extraordinary circumstances in which we now find ourselves, would you favor as well ending sentences early for nonviolent, non-threatening inmates?
Theoretically speaking, we're not opposed to reducing our inmate counts. I do believe there is an opportunity to either release some offenders earlier or enhance bail or increase the access to bail procedures. As a matter of fact, pre-pandemic, we've been advocating for a reduction in our counts. We've been bringing concerns that we've been overcrowded. So this isn't really something new to us. We do think there is an opportunity. Again, to echo the senator's comments, so long as it's done safely and with a lot of forethought, and the public safety being the number one driving decision maker behind this.
Lee, in your view, what criteria should be employed to determine whether somebody should be eligible for early release because of the current circumstances?
Well, Steve, I come from a unique perspective on this. I work with people prior to entering the system, and a number of things that I would put for a criteria, importantly, is a home to return to and strong community supports. That's key. Also, a lot of my clients have been on bail for years without issue, abiding by stringent conditions, ably showing that they were able to do so. And their offense is now years ago, and they're now in the system at this juncture, but they've proven the ability, they've turned the corner, they've addressed a lot of the issues and the mitigating factors that brought them there. And again, the people I've worked with for 10 years, we have a zero recidivism rate. So I feel really confident about risk with the clients that I have on my caseload at this point. And it's something that beyond nonviolent, I think if you look at first-time offenders, or if you look at people who have a dated criminal history, release plans, homes, these are keys, I think, to safe releasing and public safety.
Senator Pate, can you give us some indication of what percentage of the current prison population you feel could be safely released before their prison terms are out in order to deal with this pandemic?
Well, I think in some of the minimum security prisons, we're talking about virtually all of the individuals who are listed there as on their way out, who within a short period of time could likely be in the community anyway, short of whether in fact they can get before the parole board. There are a whole bunch of people who were eligible for what was called accelerated parole before it was eliminated, and as both Lee and Chris have talked about, these were first-time people, nonviolent offenses, who were deemed they could be released after a period of time. But in the mid-90s, all of the heads of corrections in this country agreed that as many as 75% of the people then in prison could be released without increasing risk to public safety. I actually don't know what each province and territory would say now, but I think most people recognize that if you provide, as Lee has indicated, supports, and right now we have many, anything from university and college dormitories to hotels not being used. Halfway houses have, when there have been, other issues like ice storms and the like, where there's been no power in halfway houses in the past, they've been able to designate hotels and other places as temporary housing facilities for day parole. Those kinds of options could be being used. There are provisions of the corrections legislation that allow for release for health reasons, for compassionate reasons, for work release. Those are all ways that we could be using it. So it could be a variety of options that have varying degrees of supervision and structure related to them that are available. And certainly I've heard from halfway houses and organizations across the country who are trying to reduce the numbers of people in those houses, not just so they can physically distance, but so they can accommodate some of the folks who might otherwise be there. And then if we see the reduction of even by 25% of the prison population, we could see the use of the physical distancing that's required within the population that's left in the institution.
Let me just read something here that, Chris represents a provincial union organization. This is a statement from the Union of Canadian Correctional Officers, and they had this to say about the potential early release of inmates. The release of a few inmates would not solve the potential spread of COVID-19 in our facilities. It would only increase the risk for Canadians. We need not look further than the recent tragedy in Quebec involving the murder of a citizen by an inmate on day parole to understand that even inmates on conditional release may pose a threat to society. The focus must be on changing routines in our institutions to respect social distancing and self-isolation practices to every extent possible. Canada is in crisis, and its citizens are already dealing with a potentially deadly threat. It is irresponsible to introduce further threats into our communities. I suspect you all want to have a kick at that, so Chris, why don't you go first and react to what you just heard?
I would agree with that statement, I guess, on both counts, both sides of the coin. I mean, if we release offenders into the community irresponsibly and without any kind of forethought, that would put an extra burden and an extra risk on the public. Absolutely. But I think given our situation in Ontario, if we use all the resources that we have available to us, we use our rehabilitation officers, our social workers, our correctional officers, and we do adequate and proper assessments on our inmates who are subject and maybe meet the criteria to be released, I think we can mitigate some risks. But again, I think that's a very, very delicate balance, and all forethought needs to be placed into there because it could have a ramification for the society at large. On the other side to it too, if we could reduce our counts, and Ontario has reduced counts by about 1,000 in the last several weeks, that does alleviate some pressures within the correctional setting. We are able to sort of move bodies. A unit that may hold 30 inmates may now hold 15, so that allows for the inmate population to sort of socially distance from themselves, if they're able to do so. It also allows us to have maybe 1 or 2 wings or units open in various centers, so if we needed to do an evacuation of some sorts, we would have the beds available to do so. So there's accuracy to both sides of it.
Lee, that's a big NO from the Union of Canadian Correctional Officers. What's your take on their view?
Well, I understand the position, and I think when they reference that case, it's unfortunate. Lifers who are on parole represent the lowest recidivism rate of all offenders. It's a one-off, it's a really horrible story, and I agree that's an example of things going wrong, no question. It's different, when we're looking at provincial, federal. In the provincial system, the 1,000 inmates or more that have been released, predominantly that was an action taken by the Attorney General of Ontario, and CLA, judges, justices of the peace, everybody played a role in new bails, and they were pre-sentenced inmates. I'm having a real challenge getting sentenced inmates out, people that are down to 2 weeks till the release date, trying to put forth a TAP for them, and I'm not having receptivity there.
What's a TAP?
Again, well, it's a temporary absence program, and in the provincial system, you can, I believe, so there was an announceable from the ministry, from Soljan, from the Solicitor General, saying that superintendents now have the power, or senior staff in corporate, to release on temporary absence programs. So if people are down to 2 weeks left and they're going to be out today or they're going to be out 2 weeks from now and they have a home to go to, again, that's key. I'm not just saying willy-nilly into the alley and all that stuff, but if there is a home, if there's a secure destination and supports there. There's also something that's very important. You have electronic monitoring ability from the federal system. It's fairly new, but in the provincial system, you have the electronic surveillance program as well. So bracelets can be put on people. They can go to their homes, and they would be at a stay-at-home order on top of probation, parole, whatever conditions.
Senator Pate, the Union of Canadian Correctional Officers, I'll read the last line again. It is irresponsible to introduce further threats into our communities. What's your reaction?
Of course it would be irresponsible to increase threats, but that's not what we're talking about. And they've chosen an example of a case which actually underscores the need to do other work in the longer term within the country, which is the failure to take seriously violence against women. That's a whole nother issue for probably another show or another day.
Actually, it's on this program as well. We're doing that issue on the show as well.
Well, there you go. So that was an issue of really that situation, in my humble opinion, not being taken seriously, and violence against women being actually not addressed. So, but if the union actually thinks locking down all of the prisons is going to solve this, then they should be looking to what's happening in those jurisdictions where that is exactly what's happened. And we're seeing huge pressures, anxiety, heaven forbid, riots and prison breaks. We don't want to see any of that. We want to see a relieving of the pressure in a responsible, structured, supervised way. We have the means available, and we need to, I think, act on it now before it's too late.
Chris, as it happens, I actually know somebody who's in prison in Kingston right now, and spoke to him on the phone not too long ago. And he said the amount of tension in that institution right now has just ramped up exponentially because, of course, the prison population is terrified of getting COVID. Does that not argue for a bit of a fresh approach on the whole sentencing issue here?
I think changes to sentencing would be beneficial. I don't know how fast or how quickly you could, impose changes to sentencing sort of on the fly. It would be a struggle, but I guess there would be some merits if you looked at it.
And Lee, I guess I should follow up with you on the issue of if you allow people currently doing time to get out early as a result of the COVID-19 crisis, how does the system police their movements, where they are, what they're doing on the outside once they get out?
Well, there's a real variance between provincial and federal, Steve, and the federal system is laden with tools, custody rating scales, assessment tools. Halfway houses are federal; they're community residential facilities. Provincially, there is no transitional supports. There are no halfway houses to be released to. So there's considerable differences between the two systems. The federal system is very thorough when it comes to assessment tools, when it comes to the process, even to release in the federal system. From the time of application of a parole application, it's 5 to 6 months at the best of times, pre-COVID-19, to see the Parole Board of Canada. And there's a lot involved with that. There's community assessments, there's risk assessments, there's assessments for decisions. I mean, it's a very detailed process. Ontario Provincial is much less involved. Certainly what we do as a firm is we put forth support letters, we put forth a release plan, a release destination, therapy, treatment. But electronic monitoring and electronic surveillance program right now would be an effective way of being able to ease the burden.
Senator Pate, how concerned are you that we may see in this country before long a riot or some kind of, who knows, some kind of violence behind bars out of deep concern that too many prisoners are going to get the COVID?
Well, I hope we don't. I hope that, in fact, we see action right away. If I was the head of corrections, I would be asking every one of the parole officers that I work with, who on your caseload could you actually be releasing now that you know it would not be unsafe? I would be looking to work collaboratively with the parole board as well. I would also be looking to encourage the minister to use the royal prerogative of mercy for those who are extremely vulnerable, who have cardiopulmonary disease, who may be at particular risk. And I think I would be using all those measures to actually move as quickly. And then in the long term, we could look at what we've learned from this process and address things like why we have so many mandatory minimum penalties, look at the remedies that Louise Arbour recommended, that where you see situations like this, we go back and revisit sentences, and that we actually move in a direction that shores up the resources that have led to more people being in prison because of addiction issues, because of poverty. And, many of us are looking at things like guaranteed livable income as some of those options. So I think in the short term, we work immediately to reduce the numbers by encouraging police, prosecutors and judges to exercise their discretion at the front end, and then look at the other end and start to be releasing those who would be safe and who can be released in a structured, supervised way, make the space inside, relieve that pressure, and hopefully we're not having this a discussion about riots or any other kinds of unrest within the prisons.
Senator, let me do a quick follow-up with you. Is Bill Blair the minister in charge of this, a former Toronto Police Chief?
Yes, it is. Bill Blair is
Yeah.
the Minister
Okay.
of Public Safety.
So have you had the conversation with him about release based on mercy grounds and that kind of thing?
I have certainly written to him, and I was getting daily briefings, and we're getting daily briefings and requesting this. I was very heartened that he said he had asked for a plan of release from the Correctional Service of Canada and the Parole Board of Canada. I'm less heartened that I have yet to see that plan more than 10 days later.
But as far as you know, he may be open to it.
Yes, absolutely. He's repeatedly said he's open to it. The challenge is getting the agencies to act, and particularly the Correctional Service of Canada at this stage.
Okay. What would you, Chris, let me go to you with this one. What do you hear back from your members, the people who are inside the correctional facilities and who have to try to maintain some sense of safety and order there? What do you hear from them right now about how nervous they are?
Well, all things considered, I think everyone's morale is generally okay. I mean, we don't have the greatest morale to begin with. We've been a system that's been sort of beaten up for many, many years. Regardless, I mean, a lot of people are doing really, really well and coming to work, and I'm extremely proud of everyone who's met the challenge. There is tension. There is a lot of worry and anxiety. Like, at the end of the day, we all still have our family members, we have our children, we have the elderlies and parents that we're taking care of. So we have that fear that everyone does as well, and we're sort of exposed to a higher risk group. You mentioned riots. Is there a fear of riots? I mean, I guess there always is that concern, even at the best of times. A riot or a disturbance sometimes can occur spontaneously without any sort of forethought. Other times you can sort of see it coming. A lot of it's dependent on the circumstances. If something were to happen in the provincial system, I'm really quite confident that our staff would be able to handle it safely.
And just a quick follow on that, Chris. To the best of my knowledge, I think there's one correctional officer at Toronto South that's tested positive for COVID-19. Do you know his condition at the moment?
No, I just know that he's still under medical care. We've had another staff member test positive from Hamilton just a few days ago.
Ah, okay. All right. I got a couple of minutes left here. And Lee, I want to ask you, you and I know each other a little bit, given all of your appearances on this program. So I want to ask you a bit of an odd question here, if you don't mind, to finish up with. And that is, you're the only one among us here, I think, who has spent time in solitary confinement. And there are a lot of people in this country right now who, and I'm not going to push this comparison too far, obviously, but there are a lot of people in this country who are sort of confined to quarters right now and find for the first time in their lives that, they can't go to work, they can't see friends, they can't do any of the things that they used to do.
Right.
And I wonder if you've got, based on your own experience, some advice for them as to how to sort of get through all this.
Right. Well, Steve, not surprisingly, this is not the first time it's come my way recently. There's a lot of people tapping on me for that one. What I can say first and foremost is Queen Elizabeth was very inspirational yesterday with her message, and to extrapolate on what she shared, from my perspective, control what you can, do what you can, be proactive. Don't let it control you. One of the things I would suggest is not ingesting tremendous amounts of news, because right now it becomes, I think, really challenging to take it all in and maintain positivity. Again, control what you can. It's a taste of what it's like to be inside right now, the loss of control, the separation from family. I think this is insightful, and it does give a glimpse into what families are going through who have loved ones incarcerated, and what people who are locked up are feeling. Another thing you can do, I think, is structure your routine. Make Monday to Friday still Monday to Friday. Exercise time, different things that you can do. Read. I would say you could embrace this time in some ways. Catch up on literature, write. There's a number of things that you can do, but most importantly, know that this will come to an end. And we don't have a definitive, it's not like serving a sentence. We don't know if it's 3 months or 6 months, but I have confidence that we're all doing the right thing, most of us, and that we will come out better for this. And I think in many ways there's going to be lessons learned, and there'll be a silver lining. So we just have to hang in there and know that it will pass.
Our thanks to Lee Chapelle from Canadian Prison Consulting, Chris Jackel from the Ontario Public Service Employees Union, and Senator Kim Pate from the province of Ontario. It's really good of all of you to come on to TVO tonight. Thanks so much for this.
Thank you, and thank you
very
to all
much.
of you for keeping us informed during this important time, and may you all be safe and well.
Amen.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.